Good morning, everyone. Allow me to make a short introduction to this panel discussion. The problem of the funding sustainability of the healthcare system, as was mentioned previously by Professor Mosialous, is something that will trouble us a lot in the future, since the changes in the age composition of the population, along with the comorbidities and the introduction of health technologies will exercise enormous pressure on the side of the demand for health resources. But of course, we also need to check the availability of health resources, since when we're talking about a workforce that will be older, further away from work, what we expect in the coming years is that the resources that will be directed to the health system will be harder to find. The certain thing is that in the coming years, we will need more space for health expenditure on the one hand, but we should not forget that the sustainability of the health system in terms of finances needs also to be oriented at creating value. We are going to discuss about these issues along with the panelists. But first, we will start with the keynote address of Pavlina Karasiotou, Secretary General for Fiscal Policy, and then we will have a discussion with Ms. Karpodini, Mr. Apostolou, who is the President of EKAPY, Ms. Prodromou, General Manager of BMS, and Mr. Papadopoulos. We are going to talk about this sustainability issue. Ms. Karasiotou, you have the floor. Ladies and gentlemen, thank you very much for giving me the opportunity to take part in the health world and to be given the opportunity to talk about the sustainable policies in health and how we can fund them. The funding of health policies is one of the most important fiscal challenges that we are already facing. And in the future, these challenges will become even greater. Essentially, we have four basic axes that we need to observe if we want to meet these challenges. And I'm always talking about the health sector. First of all, we have the workforce. That includes the medical and nursing staff, the administrative staff of the different health units. We have the pharmaceutical expenditure for the sum of the channels, that is hospitals, community, pharmacies, EOPYY, and the rest of the providers of health services and all other structures. The aforementioned axes allow us to provide integrated services. But when it comes to the financial aspect, they are competitive with one another. Their funding, the funding of one axis may deprive the other axis from valuable resources. So what we need to do is to carefully think how we can strike the balance between the two in order to meet the needs of both. At the same time, the future of funding, as I'm sure you have already discussed, is a very important point of the discussion. And the future of funding seems to be all the more demanding. Touching upon the most important challenges, I would like to mention the increase of life expectancy and the needs for long-term care, the progress in research and innovation with the emergence of new technologies, but also with the emergence of new diagnostics and new treatments, and the need of preparedness vis-à-vis healthcare crisis like the one we experienced with COVID-19, and generally with all issues pertaining to the public health, and the constant discovery of new diseases, or better, the identification of new diseases that creates even greater pressure and makes the challenge even bigger. Now I would like to refer to the fiscal environment in which we currently operate. It is stable. It is good, I would say, but it is also constraining. And this increases the need to prioritize needs and to make the right strategic choices. Up until the end of December, we will see the pass of the fiscal budget for 2025, and up until then, we are in consultations with the European Commission in order to finalize the goals and the financial expectations. 2025 is the first year that we will see the implementation of new fiscal rules, the philosophy of which lies in the control of the expenditure and the creation of fiscal space that will be used in times of recession. In other words, the new fiscal goals are based on anti-circularity, which is a term used among economists. So we are in a transitional period in the European Union. The European Commission is also going through a transition, and all of us need to make some careful steps. In this environment, Greece is entering with some good fiscal values and with high growth rates, higher than other European countries. But at the same time, it enters with an increased need for many reforms that need to move ahead, and with a fiscal space that needs to be distributed to different priorities. Another positive conjuncture for the health policies is the existence of resources from the RRF, the projects of which are currently maturing, the result of that being an increase of the absorption rate and their impact on the economy. The years 2025-2026 will be the ones when we are going to see the biggest impact of RRF on the growth rate, and the bet that we all want to win is the after. What will happen after that period? What should we expect from the budget of 2025 and the midterm planning for the coming decade? First of all, we have the continuous exercise of fiscal policy that will not undermine the sustainability of the goals and the funding on the basis of prioritization of needs. So we have a series of actions aiming at enhancing the employment in the public health system, programs for the support of public health, but also interventions in buildings and infrastructure. And many of these measures have already been announced. Actually, they were announced 2 weeks ago in the context of the Thessaloniki exposition. With regard to the pharmaceutical expenditure, we have some clear goals that have been set by the government in order to avoid surprises and unpredictable events after the end of RRF. We have taken measures for the reform of rebates and clawbacks. We have introduced policies of audit, but also important is the effort that we make for the procurement of hospital drugs through EKAPY. I believe Mr. Apostolou will elaborate on that a little bit later on. This is a mature action that is expected to bring about results very soon, but also a dialogue that has already started for the enhancement and upgrade of EOPYY. Another important action at which we place particular emphasis pertains to the reduction of our arrears of hospitals to the providers, and the Ministry of Health has set specific goals for every ministry and for every health region, and since April, we have seen a significant reduction that is very satisfactory and will lead to the extinction of arrears. Moreover, the promotion of innovation and research is another sector that will continue to be supported financially in order to see upgrade of infrastructure, but also in order to support and enhance the clinical trials. I would like to close by referring to the need of a continuous dialogue and cooperation among the stakeholders, the state, the market, and the patients, that is, so that we can actually set the right priorities and provide continuous information about the research, science, but also needs as they are being shaped. Thank you very much, and I would like to give the floor now to the moderator in order for the discussion to start.
Thank you very much, Madam. I believe that your admonition for dialogue will find many willing ears in this meeting, which is something that everyone, as in terms of partners in the healthcare system, wants. You mentioned quite a few very interesting points. I would like to cherry pick one, which is the smooth transition to the post-RRF era. And I think this is very important because this smooth transition in the post-RRF era is very important for various initiatives that were undertaken during the RRF, given that they are structural elements in the healthcare system. I'm referring primarily to prevention, pre-screening and enhancing healthcare that starts from the RRF, but it is highly important to continue. It gives me great pleasure that at the European level there is a trend to talk about neo-Keynesianism, its anti-cyclic economies and everything. But if you require evidence as to the investment of health being such an anti-cyclic economy, it will be our great pleasure to give you all the ammunition you need to support this in Brussels, and I believe that you will find this earlier. Now, Madam Governor, how does the EOPYY see this sustainability? Because the EOPYY is a big reform in our country. It is a reform that started with great ambitions. About midway, it's lost some steam, but now it is trying to reacquire the role it should in healthcare. How do you see that? Now, first of all, thank you very much for the invitation. Like Mrs. Karasiotou said just now, the Secretary General for Fiscal Policy, we as the EOPYY would set 3 axes to those challenges. One of them is, of course, keeping and meeting the fiscal targets. The second is to secure and ensure sustainable funding. And the third is to secure and ensure the healthcare system resilience in the future. The challenges are particularly significant. The previous panels alluded to it, like the aging population, comorbidities, new treatments, new diagnostic methods. Now, all this thing, through a streamlining and a rationalization of budget and securing funding, we must reimburse, refund, and invest both in prevention and treatment as well as innovation. Now, the requirements for all these things to happen, as we've discussed time and again, Mr. Athanasakis, in many a panel, a key requirement is to map the needs within the national health system, but also the needs in our country. And the next step to take is, of course, to accumulate, amass and manage funding in health. The aim always being to refund the most effective treatments, the most effective services at the best possible price. So I believe that the future belongs to the modernization of the system that starts from the intensification of audits and control, the digitization of all services and the interoperability of systems in the wider public sector. I can't stress this enough to say that in this day and age we have the perfect opportunity to integrate in our systems and by using digital transformation to renew them, to implement new techniques for the monitoring and the control and management of expenditure, but also the monitoring, the follow-up of the effectiveness and efficacy of a service that we purchase, like artificial intelligence and other modern tools. Indeed, this is the greatest challenge for us. We're already running the digital transformation project, and the key priority will be this: an increase in transparency, countable, measurable goals, and expenditure prevention, as it were, which we believe that it is a very useful and effective tool. This is a collective effort. At the same time, there are other projects running with the organization in conjunction with the other agencies, Attica, the Ministry for Labour, and so on and so forth, in order to be able to manage in a much more effective and efficient way expenditure. This will create the space to pave the way for new innovative treatments and to fund new diagnostic tests such as biomarkers, to enhance negotiation, which at this part it helps us by innovating and taking into consideration the need for targeted treatment. The negotiations committee has already started striking deals on the basis of the biomarkers required in order to direct each treatment to those who really need it. So altogether, this is a collective effort. We have as our goal the streamlining, the rationalization, and the ensuring that the system remains sustainable and flexible. Thank you very much, and I think that this issue of consultation and negotiation is something we can actually step on, and it was used as a monopsony. So we want this to exploit and utilize its monopsony actually place in the market. And I think it's a very good thing to see that there is a lot of progress in biomarkers, and this is a way to resolve a big problem with the health system, which has to do with access to these technologies, which are critical, I say, for the course of treatment of all patients. Of course. Now, in terms of clinical effectiveness and financial efficacy, the part of EOPYY's transition to the digital era is, I believe, an excellent subject which I would like us to touch later on if we have the time to make some comments, both in terms of prediction but also to the transition in the next step of expenditure. Now, before making the comments, allow me to give the floor to Mr. Aris Apostolou, who is, of course, president with the National Centralized Health Procurement Authority, EKAPY, which is an old, new development as it was reformed very, very drastically in the health system, which plays a crucial role, a critical role, and may save a lot of money.
Thank you very much for the invitation and the opportunity you give me in order to explain to you what we can do on our side in order to enhance the sustainability of the health system and to further support it. During the last few years, we have had the support that we needed by the political leadership because it believed in the value of this centralization. As you said, following some years, EKAPY has started operating at a different level. We have completed tenders for drugs of millions, and we have made savings of approximately 50%. The need to implement these tenders and to fully distribute the 50-30-20 to every consumer led to the development of this central platform for order taking that was also proposed for all drugs purchased by hospitals. On the basis of this platform, we have managed to have a clear picture of what every hospital purchases, and slowly but steadily we are entering the process of audits and controls. And just like we saw with the example of EOPYY some days ago, which on the basis of the digital tools ended up in dealing with a major scandal with the collaboration of the police. We also have the same vision. We want to fight fraud, and we are sure that we are going to do that by using these new technologies. Now, at a later stage, we are going to approach the clawback for drugs that has a significant fiscal footprint. Our objective is in 10 days to have completed we will have completed the first semester of 2023, and a little bit later on the second semester of 2023. Then, in full understanding with the political leadership, we are trying to complete by the end of the year the first semester of 2024. This process has become faster, and on top of that, all data can be found on the platform of EKAPY. That is, the first semester of 2024 can be consulted online. We have digitalized the data. Moreover, we have some central procurement process, like, for example, the drugs for strokes. And now we are doing the same for other products. And right now we are operating the central order taking for hospital waste. A central tender amounting to 40 million annually will now take place centrally through EKAPY. The understanding that we have with the leadership is that every tender that is completed will then enter the system of the central order taking so that we can have real data for everything when we need them. With regard to savings, okay, when it comes to medtech, there is not a greater discount than 10%, as is the case, as is not the case for other drugs, for example, where we have 60%. But slowly, and by mapping the needs of the hospitals, in other words, trying to check how many of these are being used, how many kilos were used, we will be able to use comparative data that will lead to better management and also to a better allocation in the future. Do I have a couple of minutes? Okay. Another hot issue is that after the amendment of the legislation, I'm talking about the rebate for medtech and for drugs, what we are going to do is to propose some limits for the application of this rebate. The maximum will be 7%, but we expect on the basis of the analysis that we have made that it will be lower. Moreover, last week, we issued the technical specifications for the big project that is incorporated in the RRF and that pertains to the upgrading of the equipment used in hospitals. A tender of 63 million value, and indicatively, I can tell you that there will be 5 linear accelerators, 4 magnets, 7, 8 coronary measurement devices. There's going to be a range of devices distributed in over 85 hospitals of the country, and this distribution will be made on the basis of the needs of the hospitals. There were some devices in the hospitals that were not used properly. There were other hospitals that had the people to use them, but there was no device. This is something that we realized after an analysis we made. And following that analysis, we expect that in 20-25 days, this tender will be launched and will lead to the upgrading of the hospitals. Moreover, with the political leadership, we are in an understanding in order to identify some parts of these devices that were not included in this project because of the budget. We thought of using the PEPs as a Ministry of Health and to set the priorities. Okay, thank you very much. I believe that the EKAPY has started to take on a crucial role in the financial flows of the health system. From what I can see is that there is, of course, a concentration of resources, but at the same time, a concentration of data. And this is very promising. Of course, what we need to do now is to see how we can best use this data. And if we have some time at the end, I would like to ask you about the role of EKAPY in the new framework of hospital reimbursement that is about to start with the DRGs. I believe that this is of interest for our audience. So please keep in mind this question for later. I would like now to give the floor to Ms. Elizabeth Prodromou. Prodromou is the General Manager of BMS, the space of drugs is a space of ideas and of proposals, especially during the last few years. Many of the initiatives that have been taken aim at the sustainability of the health system. What is your view on that? You will allow me to reply by using some numbers that I know you love. I would like to use a slide, please. The value of innovation cannot be disputed. You know, Mr. Athanasakis, you have conducted research. It has offered to our country approximately 0.9 years to life expectancy, and this will increase. And by looking at the future, we know that we will have to deal with more difficult diseases, with the aging of the population. Cancer will become the first cause of death. This will be the case in the coming decade, according to the experts. So the challenges that are lying ahead will be great. At the same time, we are very happy about the fact that our country is close to the European average when it comes to access of patients to new treatments. Of course, there is always room for improvement, but we can also see that there is aggravation when it comes to access that we didn't see in the past. You can see 53 has become 47%, and this is a weighting indicator according to the recent data, and we need actually to assess this percentage and take action in order to deal with it so that it doesn't increase further. So where do we stand today? We have a budget of approximately 2.5 billion euros. This hasn't changed since 2016. We have some influx of new resources. Our expectation for 2025, we are going to have 1 billion. And at the same time, something unbelievable happens. The expenditure increases constantly, uncontrollably. Of course, the ministry has taken some action in order to deal with that. Then, the answer to every question is clawback. During the last 15 years, to any question we have about the balance between expenditure, budget, and rebate, the answer is clawback. Clawback that is not rational, clawback that is inflationary, horizontal, and we all agree that it shouldn't exist. And lately, and you will see actually the estimates pertaining to the increase of expenditure, always on the basis of invoice, not ex-factory. So we are faced with an increase of pharmaceutical expenditure that is unequally distributed among the different channels. So this is the picture that shows an imbalance in the system, an imbalance that we need to deal with collectively. And here is the myth of the expensive, innovative drugs. This is a myth that is constantly being reproduced. The average price of on-patent products for our country, please include in the first column where Greece is mentioned the compulsory rebate that we have to deal with. If you take this into account, then you will realize that the average price of the on-patent drugs for our country has the lowest position. At the same time, another distortion is taking place. It is another pathogenicity of the system, and this pertains to the penetration of generics, which is the lowest in Europe. Next to that, I'm giving you a list of countries, not in order to make some unfortunate comparisons. No, I'm doing that because these countries do not have the same prevalence, do not have the same impact on diseases, nor the same health systems or reimbursement systems and other health data. Some of these countries are at a more mature level. However, I'm giving you this list of countries because they have clawback in their health systems. They have incorporated the compulsory refunds as a means of funding. But what do? They define them approximately to 25 to 30% maximum because they perceive clawback as a funding measure, but at the same time, They want the pharmaceutical innovation and the pharmaceutical technology to continue existing in their countries. So what we can see is this need for a new architecture of the system of pharmaceutical policy. Where do we stand today? The ministry is in the center. It exercises fiscal policy, partially, and developmental policy. The Ministry of Development and Ministry of Finance are less interconnected with the partners of the ecosystem. Patients' associations and other parts of the system, and at the same time, all the distortions and pathogenicities are being reproduced. The fact is that the clawback was made for the Ministry of Health a fiscally neutral measure. So what do we propose? And since I'm part of the board of directors of PIF, what we propose as industry is a 3-year partnership agreement that will include the interconnection of all the different parts of this ecosystem and will ensure sustainability and predictability for the entire ecosystem, and will give the opportunity but also the dynamics of a guaranteed access for all patients in the future. So enough with the wishes, because wishes cannot help us move forward. No, we need to set specific conditions and steps for the future. And we need to make these steps in order to enhance sustainability and predictability, and in order to enhance the continuous access to new treatments for all patients. There are two parameters. There are two relations that we need to focus on. First of all, increase of the public budget and reduction of the overall pharmaceutical expenditure. These two are interconnected. They cannot operate independently. And generally, the partnership agreement actually includes these parameters and has specific steps that need to be taken and specific conditions that need to be met. Transitional reimbursement is one of them. Funding tools, which are best practices in other countries. Mr. Athanasakis, you are aware of this because you have taken part in different studies. Then, active budget aligned with the horizon scanning in order to identify which are the diseases that will emerge and which are the real needs of the population. Funding from the public budget, and of course, a reduction of the overall pharmaceutical expenditure. We have been discussing about all these things, and we have all agreed that the most important factor behind all this is data, measurable data. We need to use data in order to know what's going on in every hospital. Of course, implementation of therapeutic protocols and diagnostic protocols, and agreements at the level of negotiation. And with that, I would like to hope and wish that in the end we will all be able to work together and to follow one direction. The direction that is based on the redesigning of the pharmaceutical policy, a direction that has at its center patient and the citizen.
Thank you very much indeed. Now, I think it was a long-winded answer, but I always prefer we speak with numbers. Yes, well, it was true, but okay, personally speaking, this is a soft spot for me, talking about health taxes. I think it's something that we need to look at. Apart from its financial and funding benefit, but the net, because this is the thing. These health taxes are combined with some subsidies. One of the implementations we have here, it's something we could see, and it's this type of taxation is there to create healthy behaviors, which is what we need. And we're living in a country that, despite the great life expectancy, it's 7.8 years, and in Norway it's approximately 18, the healthy life expectancy. So we need to set up policies that will keep people alive and well. Now, I see, and we often discuss, that many of the key policies in the triptych of values, volume, mix for healthcare expenditure did not go to the level we would like. And a characteristic example is what you showed here regarding the generic drug prices. It was an article by our team that was accepted today that as of 2012, the key factor that has changed expenditure either upwards or downwards when first applied was the changes in the mix of pharmaceutical expenditure. Now, we have things that are proved here and numbers on the basis of this factor, but I will come back to this because you proposed a very peculiar and particular, I would say, solution. But allow us to give the floor to Mr. Miltos Papadopoulos and his opinion, who's head of market access in a cluster of companies in Alcon, which is a biotechnology company. And it's true that in Greece we're talking about drugs a lot in terms of sustainability, but we have left a part that is increasingly developing. We have talked a lot less about it than drug, and we try with the CSEE there and to see how the audit assessment in terms of devices. And we started a discussion, and we'll give the results of this discussion in the next days in the public sphere, and we'll carry on this discussion. Why? Well, because this type of technology is a key factor to determine how care will look like in the future. Yes, well, I couldn't agree more. The medical technical product is indeed a key thing for patient health. And in the creation of sustainable strategies in terms of health, there's a lot in common with drugs, primarily through these areas. I mean, it requires long-term strategy. If we are ready as a sector and as companies for us to give the innovative solutions, I would like to say that we are. To what extent the system is ready to have such solutions and adopt them is something that is still in progress, and it's pending. Depending long-term policies, this is another issue which requires consensus from all sides. In Greece, as we said earlier, we have an increased demand in healthcare services with the aging population and all the other features and characteristics we discussed. We have an ever-increasing cost of health, and at the same time limited reimbursements, both in terms of the public sector and the insurance companies. As we all know, in practice, this leads to a greater participation, to rather more out-of-pocket participation of the patient with destructive consequences for their family income. So what we suggest and we're trying to get is to move to a model that is based on value-based healthcare, that is based more on quality and the result of treatments in order to be able in the long term to ensure and secure the longevity of the system. Now, we mentioned various factors, the European funds, the NSRF, the RRF, which contributes to new investment, but we also have a model we can see, the PPPs, the public-private sector partnerships, which can play an important role in new investments, in new large-scale investments, but also into bringing know-how into the public sector. I should like to focus our discussion on the tendering process. Because, well, you see, the procurement of biotech products is through tendering procedures in the Greek public sector. At the moment, the main criterion is the lowest price. So in practice, this devalues the whole procurement system because we cannot give patients newer technologies, or they do not include criteria such as material quality, effectiveness, or clinical trials and clinical data that we can have, or even the availability of the product itself. So a proposal might be to move on to a model that is most economically advantageous tender, in order to be able to give what's best for the patient in the best price. Now, in terms of medical device, of course, we need to utilize artificial intelligence, telemedicine, and to pay more attention to prevention rather than treatment alone. Now, recently, we had rebate in biomedical products, and the President talked about that earlier. And I think it is something aimed at collection. It is something that aims at reducing expenditure regarding competitiveness and keeping investment or even new investments in new technologies. Now, please allow me, after these things that you said, to have another comment. And please allow me to start in the other way around. Now, in one turn of speech, he said something that is very important and should be of concern, that has to do with the quality of data that are filed in the tendering processes, and, if I may, the quality of the vendors or the providers. This is something we need to see, so that this sector to be better controlled, not just for its financial impact, but because we're talking about products that have a direct impact on the population's health. The future will change, it will contain much more biotechnology, so it's something that we need to see. At the very least, to the extent that we use them for drugs in such a strict environment. But allow me to ask something about rebate. Now, on the one hand, truth be told, we have the capacity and the capabilities of the state, but on the other hand, we know that rebate-type practices or even clawback can create distortions in the market. What have you to propose? Now, taking into consideration these involuntary impacts of rebate, which can be the reduction of jobs, reduction in the access of new technologies, or even less access to training of healthcare professionals, it might be more easy for someone to be able to upgrade the price observatory that already exists with a new model that can give a range, price range, or a bracket. And it's something we haven't seen. And we might be able to talk about the DRGs, or even the digitization and merging of the IT systems of the health sector, in order to be able, in terms of a compensation or a set-off to the measure you're talking about, to give the results that we want. And at the end of the day, for the patients to be able to receive the services they can and have access to new technologies. Thank you very much. Mrs. Prodromou, you set a new framework of collaboration or joint decision-making process. Is it something we need? And if so, how can we make it happen, do you believe? What are the requirements for success?
Absolutely needed. And allow me to touch upon the qualitative elements first. I believe that what is absolutely necessary is a vision and political will, so that the politicians can actually leave the mark even after the end of their mandate. I believe that it will be the most meaningful reform that will have taken place in the last 15 and more years, since it will be based on the need for predictability. So some conditions, some prerequisites, convergence and cooperation. This will come about after all the ministries decide to do so. It is very important to have this convergence. It also needs to include different projects, funding projects, specific timelines. It has to be directed towards the two main pillars, rationalization and reduction of pharmaceutical expenditure, and the second, increase of budget. But not just like that, with arguments where, why, how. If Ms. Karasiotou would give us the green light tomorrow for 1 billion more euros, we would not be able to use them appropriately. You probably agree. A 3-year framework of cooperation would allow us to know how to best use this money. So this would bring about benefits, benefits for the public, benefits for the patients, guaranteed access. benefits for the growth of the economy, because it is indisputable that we will have further growth because of the predictability in the system. And, of course, we will be able, the different sectors that is, to operate in a healthy level of predictability and to take effective action. Thank you very much. I agree with what you said about prioritization. I thought you agreed with the 1 billion. 1 billion and even more. But the way is always the same, because prioritization needs to include, in my view, data, but also the preferences that exist. But we don't have time to discuss about it now, maybe sometime in the future. The funding of the hospitals will radically change. What should we expect from EKAPY at that level? Reimbursement of hospitals on the basis of activity. As EKAPY, we take part in this process in an accounting role. When we had to check the cycle of the money, we had to know where the services were bought and how the services were paid for. This is something that we do in collaboration with KETECHNI and with the ministry. Okay, but I believe that you will shoulder a significant burden when it comes to the negotiations for the standards in the DRG. So the expectations will be high for EKAPY in the future. Negotiation is one thing, the tendering processes are another. Even in the tenders, there can be some qualitative criteria or polycentric studies when it comes to one material. What we don't have for medtech nor for drugs is the following. We don't know, or we can't measure. We do not know the outcome of the use of these medtech devices or drugs on the health of the patient. We need to have data, and we will get this data from our registries. This will allow us to see how the different drugs were charged for the patient and how they have improved their life. Once we are in the position to measure all this, then we will be able to decide where to spend more money on. Thank you very much. This gives me the opportunity to ask Ms. Prodromou something about EOPYY and digital transformation. In your view, what will be the benefits of digital transformation, especially for EOPYY? Thank you very much for this question. Allow me, Mr. Athanasakis, before I answer to your question, to say the following. Ms. Prodromou, in her second intervention, said it correctly. She said that even if we had 1 billion to spend today, we would not know how to spend it. I'm not going to agree with that. I don't believe that the budget has remained the same since 2015. It is 1 billion plus. So we have the 350 investment clawback, 170 the vaccines that were outside the budget and are funded by the state budget. Another 60 millions were given by the state budget in order to cover the EKAPY, the expenditure of patients and the expenditure of European citizens. In the RRF, and with funds of the ordinary budget, another 300 were given, plus 100 million. So we have reached 1 billion. Our negotiation during the last couple of years, under the leadership of Ms. Kokozougou, has led to additional savings. We had 150 million savings. Now we have 600 million savings. But indeed, Ms. Prodromou, there is a derailment. And this takes me to the answer to the question how we can deal with this challenge. In order to ask for more money, first, we need to make sure that the one we have is effectively used, and any additional amount will be used in the right direction. So, First, we need to find new tools, and the digital transformation, indeed, Mr. Athanasakis, can help us in different ways. It can help us fight over prescription. The Minister has already announced some additional measures. We are already running with the collaboration of many ministries an action for the distinction of AMCA, the insurance number, into active and non-active. Following a control we did, we realized that a large part of the fraud, to the detriment of the organization, stems from non-insured people, Roma, migrants that have been extradited, and people that live in migrant shelters or prisons. So with the digital transformation, we don't simply want to become more modern and to use more modern systems and applications. No, with digital transformation, we want to enhance transparency. We want to combine protocols, medical and scientific, with reimbursement and patients' registries. We want to evaluate the med technologies by measuring the result, and we want to give reimbursement always on the basis of the outcome of novel treatments and medtech. The Committee for the Assessment of Medical Technologies, the Negotiation Committee, EKAPY, EKETECHNIN, with the introduction of DRGs, have joined forces in order to do that. And with regard to DRGs, they are a major innovation, by the way. And through the digital transformation and the new tools that we are implementing, like real-time audit, along with the right way of pricing, we will be able to control, check, and assess the service that we get. Because at the end of the day, what we want to do is to buy from the one that ensures higher effectiveness. And generally, the overall philosophy, pay for performance, has prevailed in the discussion, and it's good to hear that you are about to implement this concept. Ms. Karpodini, anyone who is involved in public financial policies is asked to give money. We know that. So I would like to ask you, how can we possibly prioritize health when it comes to social expenditure, which, as you said, needs to be balanced, because 1 billion that may be given to health will be taken by another sector, defense or another sector. So how can we possibly create a fiscal space for health?
Now, health is among our priorities, and as I said, within health, we have a series of axes where the similar prioritizations also need to take place, and we have the part of staff remuneration, infrastructure, and of course pharmaceutical expenditure, which is a huge chunk. Now, before we talk about an expansion or extension, I should like to focus, and I will always focus, on what we do with what's there, with the existing ones. The two key words for me is streamlining, rationalization, and assessments and evaluation. And Mrs. Karpodini already mentioned the numbers, so I will not repeat them. There is a steady increase. I will call it rational. You may call it very restrictive, but that is of little interest. There is a specific increase. There is an established increase of the level that covers inflation, so as not to lose the value of everything. So I don't want to give you anything else from the backstage, because next week we'll have the presentation of the draft with the cabinet the ministerial cabinet, and that's where we'll talk about everything. But I would like to go back and say that today we are at a stage when we're implementing tools that are entering a stage of maturity and must show results. I'm talking about the DRGs, where we need some additional maturation. It is not entirely there. It is the remunerations. There's a lot of things, and it's the part of the uninsured persons. Now, SSN, the Social Security number, or AMCA, says that there are several thousand people who appear to have access through their SSN to health and are no longer working in the country. It is a rather large range. I would like to say that performance enters into the discussion. It still remains to see how this will, what this will happen in action. It's something that we didn't discuss as of now, and we'll need to see how this will be expressed. But also controlling demand with various tools and controlling the entry of drugs in the country. What do we mean by that? With the various channels and how these will be able to be limited and delineated and help us control expenditure. I don't know whether I was in great detail, so you said everything and you shared news bits and news bites with us. Thank you very much. I'd like to thank the entire panel for this discussion. Thank you for being with us, and is it time for lunch? Lunch. Grub time.